There are a number of types of weight reduction surgery. At Mayo Clinic, the most commonly performed procedure is called roux gastric bypass surgery. Clinical research has shown this procedure to be the safest and most effective. Roux is the name of a surgeon who first described part of this technique. Y refers to a Y shape in the intestines created by this operation. The word gastric refers to the stomach. Here's how the digestive system works. The stomach's most important role is to hold the food you've just eaten. Digestive juices in the stomach begin to break down the food. The food then moves into the small intestine, where other digestive juices help the body absorb nutrients, such as protein. Certain nutrients are broken down to provide energy, which is measured in calories. If you eat less food and your body absorbs fewer nutrients, you'll get fewer calories. Here's how gastric bypass surgery accomplishes that. The surgeon separates a very small pouch of the stomach from the rest. That will be the only part of the stomach that receives food. This greatly restricts the amount you can comfortably eat and drink at one time. Of course, what you do eat and drink has to get out of the pouch. So the small intestine is cut across a short distance below the main part of the stomach and connected to the new pouch. Now, food and liquid will flow directly from the pouch into this part of the intestine, bypassing most of the stomach. The larger part of the stomach, however, continues to make digestive juices needed to break down the food. So the portion of intestine still attached to the stomach is reattached further down. This allows the juices to flow to the small intestine. That forms the Y shape mentioned earlier. Notice that the food travels through a portion of the small intestine before most of the digestive juices are added. In that upper section, far fewer nutrients are absorbed than usual. That means calories are also reduced. This operation may be performed in a way called open surgery. An incision or cut is made in the abdomen so the surgeon can reach the stomach and intestines. Sometimes the gallbladder is removed during the operation. Gallstones are more likely to form when a great deal of weight is lost very quickly, as in the first 4 to 6 months after bariatric surgery. Gastric bypass can sometimes be performed in a way called laparoscopic surgery. Several small slits are made in the abdomen. A viewing instrument and surgical tools are passed through the slits. The surgeon is able to see the stomach and intestines on a monitor. The advantages of laparoscopic surgery may include quicker recovery and fewer complications with the healing of incisions.
Postoperatively, the bariatric patient is left with a pouch, which is their new stomach, and it's approximately the size of a walnut. Because of the size of the pouch, we are very specific in allowing the patient to consume very limited quantities of food from initially right from the very first day post-op. So we have developed the post-op day 1, day 2 clear liquid bariatric diet. That diet allows the patient to have 1 ounce of fluids per hour. This fluid is to be consumed slowly at the rate of about a teaspoon for every 15 to 20 minutes. Food service will be delivering all of the fluids that the patient is to get during their hospitalization. And they will be doing that at regular meal times and regular nourishment times. So at breakfast time, when the patient receives their tray, it will also have a smaller tray on top of it, and on top of that tray will be the 2 ounces of fluid that they're allowed to have that should take them until 10 o'clock. At that point in time, they will get another 2 ounces of something, and this something happens to be Jell-O. 2 hours to consume that. Then they will get 2 ounces of hot broth for lunch at noon. They will get 3 ounces of Crystal Light beverage to consume over the next 3 hours, because then at 3 o'clock they get another 2 ounces of Crystal Light. The Crystal Light we will make in the food service department and keep for the patient. We're using the bottled water with a packet of Crystal Light. We will ask the patient which they prefer, and we'll know that post or pre-operatively from the dietitian, and the outpatient will tell us which flavor to offer. We will not send this entire bottle up because we don't want to risk the patient consuming it too fast. At 8 o'clock or 7 o'clock at night for their snack, they will again get more Crystal Light. So the items on the clear liquid diet that they're allowed to have is the clear broth, the sugar-free Jell-O, the sugar-free Kool-Aid potentially if they don't want to drink the Crystal Light. Patients are not allowed to have straws on their trays. They're not allowed to have any carbonated beverage, and they're not allowed to have any coffee or tea, and that includes decaffeinated coffee or tea. These are the only items the patient should have on day 1 and day 2, except that after 10 o'clock at night until 8 in the morning, if they are awake, they may consume an ounce an hour of water. Again, sipping a teaspoon every 15 to 20 minutes. After day 2, per the surgeon's advancement of the diet, we will put the patient on the bariatric full liquid diet. The patient now will be allowed to have 2 ounces of fluid per hour, and we have changed the items a little bit. We'll be offering them skim milk, cream of wheat, sugar-free vanilla pudding, sugar-free vanilla yogurt, and again, there's no straws, there's no carbonated beverages, there's no water pitcher at bedside, there's no caffeine being offered. 2 ounces of fluid per hour being allowed, so they're going to get 2 teaspoons every 15 or 20 minutes. And with the full liquid, then this is as far as we advance the patient, because they will stay on this for the duration of their hospitalization at discharge, following these same diet guidelines for approximately a month post-op. You have a packet of information about the procedure, and the back page is the diet guidelines or the progression from clear to full liquid for the bariatric patient. The bariatric team dietitian has met with the patients pre-op, will follow them post-op. The hospital dietitian is available to you if you have any questions or concerns about the patient while they're here at Luther. Thank you.